Welcome to The Doctor Will Hear You Now, a podcast featuring our physicians and other healthcare providers telling their stories, sharing glimpses into their daily work and mission, and showing what it means to practice medicine just a little bit differently. Healing you means hearing you. Let's talk. I'm Ben.
And I'm Lexi, and today we're joined by nurse practitioner Katie Doggett, who provides primary care at Our Lady of Lourdes Physician Group Family Medicine Practice in Sunset, Louisiana. Katie shared with us a bunch of really helpful things as it regards to primary care providers and getting established with a primary care provider. You'll hear us talk a little bit about why it's so important to have that relationship and get established. And you'll hear us use words like PCP and phrases like that. And so she explains all of that. So don't worry if all of this is new to you. One of the biggest things that I took away that was surprising to me that a PCP does is she talked about these mood check-ins and how primary care providers can really help if you have feelings of anxiety or you're dealing with ADHD. They can really help you navigate that, get treatment for it. And that just really shocked me because I wouldn't have thought of associating a primary care provider with that type of care. Ben, anything stood out to you or was kind of surprising that Katie shared?
Yeah, definitely. I was really interested to hear from her about what goes into that first primary care visit and how you should prepare. The questions that you need to bring with you, maybe the notes that you need to have ready, but then also even the medications that you take and even the vitamins that you might take. Normally, people might think they just need to write those things down and bring that list with them. But she was really encouraging people to bring all of that with them so they can look at those medications together and figure out dosage and what needs to change there. So that was really interesting to hear from her.
Yeah, I thought that was interesting too, and something I would not have thought to do. I think the most important takeaway that our listeners can really leave this episode with is Katie talked about why it's important to go and see a primary care provider or to go, to see a physician before you're sick. So you don't have to be sick to go to make an appointment or to get established. Well, I guess with that, we can dive in and let's hear from Katie. Katie, welcome. We're so excited to have you join us today.
Thank you for having me. I'm excited to be here.
Of course. Well, we're glad you're here. Let's just start with the basics. We'll kick off with the easy things. Tell us a little bit about yourself and the work that you do at Our Lady of Lourdes.
Okay, yeah, sure. So my name is Katie Doggett. As you said, I'm a family nurse practitioner. I'm located in Sunset with Lourdes Physician Group. I am born and raised in Carencro, Louisiana, which is just maybe like 5-10 minutes from Sunset, not very far. It's right down the road. I'm married to my husband, Josh Doggett. He lives also in Carencro, but he's from Maurice. I know the last name's a little confusing because people are like, are you from here? Yes, we're from here. So he also works for Our Lady of Lourdes. He works in the ER over at Heart Hospital. And we have a 6-year-old little girl, and we love to travel. And that's a little bit about my history. I've been with Lourdes since 2013. I started off on PCU and then went to ICU. Then went to Heart Hospital for a little bit, then back to ICU, and now I'm with Lourdes Physician Group.
Oh, wow. Awesome. It's cool to hear you've had a wide range of experience. Can you tell us a little bit about what made you land primarily in a nurse practitioner role, but then also in the primary care space from being in all the different ICU areas? What made you land there?
So there was a lot of experiences that I had in ICU where patients had different situations that they were in ICU for. And some of them were preventable. And some of those preventable things could have, they would have had that access to that primary care physician to treat them for their hypertension so they didn't have a brain bleed, stuff like that. That's what made me say, I want to get to them before they get to this point. And so that's what had me interested in family medicine and primary care.
Cool. Well, I'll back up a little bit because I think our listeners, they come from a wide range of people who know a lot about healthcare, people who are maybe new. And as you know, healthcare has a lot of jargon, lots of different words. And so primary care really is to level set here for our listeners, is really about kind of your health from all areas of life, and your primary care provider helps to direct your health from screenings and other opportunities like that. And so you said specifically family medicine. Can you tell us more about what it means to practice in family medicine and what that kind of means within the primary care space and caring for whole families in Acadiana?
Yeah, so for family medicine is a great resource, particularly for those who live in like the outlying communities. It can be difficult to go into town during a busy work or school week, and just having that access in those rural communities is huge. The whole family can go, especially like during those winter months where you have these cold and flu symptoms. They just become more prevalent, and the family all needs to be sick. And so instead of having to go to several different doctor's appointments, you can be seen, anywhere from an annual wellness visit to advanced care planning, across the lifespan. And so that's really convenient to a lot of these smaller areas.
Yeah. And so a lot of what we want to pick your brain about today, I guess, is why you should get established with a primary care provider. So I guess maybe walk our listeners through that experience through primary care and how a patient benefits from getting established with someone like you.
So primary care is where you can establish that relationship with a provider, or as we call them, PCPs. They get to know about you and they help you manage your health. And I do think it's important to mention that many of our PCPs do offer cervical cancer screenings, such as pap smears, and many patients do not know this. I know my own mother mentioned, she's like, I didn't know you did that. So, especially in these rural communities where it's difficult to even go to town, I think that's an added bonus too, and patients are involved in their own care through MyChart. And having a primary care provider is different than just going into a walk-in clinic where you have a different provider every time you go. All of your health information is kept in this electronic record, and that can be easily accessed by not only the patient and the provider, but through our health systems, such as, our step-in clinic, on-demand video visits, Lourdes Physician Group, Women's and Children's Hospital, Scotty D, Our Lady of Lourdes, and Heart Hospital. And this just allows us to give our patients better access to care while also having the most up-to-date information on their health for our providers.
And that's a good note, too, about cervical cancer screenings. I'm curious, are there some other types of screenings that a PCP provides that patient might not be aware of?
We can offer colorectal cancer screenings. We'll either, depending on their history and their situation, we can either refer them to somebody to do the screening, or we can do something called Cologuard, which is something that can be mailed to their home, and they do a stool sample, and that's an easier way, depending on their history, that we can get our patients screened.
I think it's really great, just like you said, focusing on preventative medicine and how can we keep people out of ICU and out of the ER as much as possible. And it sounds like primary care really is the key to that. But I guess for those, it can really be, I'm thinking about those who are maybe scared to go to the doctor or haven't been to the doctor or have seen a provider in a long time and know they need to go and see a primary care provider. So that can seem daunting to them to get established. And I know you mentioned some of the ways that we make it easy to connect with us. How can, for someone who maybe is scared, right, to make that jump, to make that primary appointment, can you walk us through how we make it easy to connect and how we can really help be a bridge to them in that relationship? If they want to make an appointment within our system or anywhere, how's the ways that they can do that?
Yeah, so don't be intimidated. I'm going to start with that. It's easier than you think. There's two different options for making that appointment. You can either make it online or you can call our call center to book a new patient appointment. And online, you can search by location, different providers. You can filter by that as well. And, I really feel like the part that I try to tell patients when they come in is like, I'm your partner in this. This is your health. I'm along with the journey for you. I'm here to lead and guide you and help you build this relationship and to just be your best self and help improve your health.
Yeah, that's great. It's good to know too that we do have options for you to find the provider that's right for you. And part of that filtering, right, is to see what are special interests or things that you like your doctor or your provider likes to hear about in caring for you. Are there things that in particular that you like to hear from your patients as like, I know sometimes not even hearing about, you would think that sharing about your family or your interests or your hobbies may not be things that are important to your health, but can you talk a little bit about how they are really giving you the full picture to be able to care about? Are there certain things that you wish patients would share with you? Anything in that space?
So I have a little yellow sticky note in the corner that I write those things down. If like a patient tells me they're going on vacation, to me that's important. Are you going out of the country? Do we need to get immunizations done before we go? But then it's also like when they come back, I'm like, well, how was your trip? It helps improve that relationship while also feeding into me, letting me know they're going out of the country. Are we up to date on those immunizations? And I like to travel too, so I want to get the scoop from them. Where did they go, and did they have a good time too?
Yeah, for your own ideas, right?
Yeah, definitely.
Yeah. Well, thinking about the things that a patient should come prepared with for that first primary care visit, what's something that you would suggest to them? Just kind of walk us through that first appointment and how they should prepare.
So new patient visits is where I get to know my patient. I review their past medical records, request records from previous providers, review their healthcare team, such as knowing like some of the names of the specialists that they see, and review any kind of current health issues if they have new problems. This is where I want them to bring their medicines. A lot of times they come with a list. I want them to bring it because I'll ask them, what meds do you need refills on? And they go, I don't know. I'm like, okay, bring those bottles so we can see on the bottles, how much do you have left? Also, their supplements. Sometimes they'll bring supplements. Sometimes those supplements interact with other medicines. And then I want to see how I can best assist them. I call it like our planning session. We kind of say, okay, where are we going to go from here? What's our next step? What else can we work on?
That's great. And that's a great point about the supplements. And I'm assuming when you say supplements, you mean vitamins and other things they're taking that maybe aren't necessarily prescription, but over the counter.
Right. Exactly.
Yeah. Yeah. So all of those things are important to share.
Yes.
I guess kind of going through of that continued relationship, is it just you have an appointment and then you're done until the next year and you don't hear from them again? I guess my point is knowing that you want to keep that relationship and keep those lines of communication open. What are some ways that established patients can stay in connection with their provider if they have questions about things over the counter or worried about things? Are there ways they can stay in touch in between visits?
Yes. So we have MyChart. If you get your MyChart activated, you can send messages. I try to do a good job of any time a patient comes see me. I usually attach education on there for them. But I always go over with them, okay, do you have access to MyChart? Do you know how to use it? You can always send me a message. If they don't have the ability to use MyChart, I tell them you can call the call center, leave me a message. You have a question, we're going to get back to you. I tell them that when they leave the office, I'm under the impression that they're doing better. If they don't tell me that they're not doing better, I don't know. So if something we went over, they started on it or couldn't afford it, please tell me because I'm there to help you. And so I can't help you if I don't know what's going on.
Yeah, that's great. Great advice. And it's great to know you can stay connected beyond just in-person visits. Or do you typically meet virtually with patients? Is that something that happens in the primary care space, or does it have to be in person?
Depending on what, I'll do some same day sick visits virtually for my patients. I'll do mood follow-ups. If they have a verified cuff on file, I can do hypertension follow-ups. It just depends on the situation. But personally, I tell my patients, if I want you to contact me, I'd rather squeeze you in or do a video visit instead of you having to go to an urgent care.
Oh, yeah, that's a great point. One thing you said really sparked something for me about a mood follow-up. Can you tell me a little bit about that? I haven't heard of that before.
So we can do it with stuff like anxiety, depression, ADHD. stuff like that. I want to know, is that medication working for you? Do we need to change anything? So those are some of the mood follow-ups that we'll do.
Oh, okay. Thanks for talking through that. I just didn't even realize that's something that you can cover off on with your primary care provider.
Yes, we offer a lot of things. You'd be surprised.
When it's too personal to discuss over coffee.
She knows private things I won't even tell my best friend.
He knows the sight of needles makes me squirm.
Primary care is personal. Good health starts with a provider who listens and gets to know you. They know your fears and your health history.
At Franciscan Missionaries of Our Lady Health System, you can experience the difference of having a dedicated healthcare partner by your side. Find a primary care provider who is ready to hear your story. Visit findmypcp.com. Well, going back a little bit to something you said earlier, you mentioned on that first visit reviewing their past medical history. I'm curious how that works for a patient that might be new to our health system. They might be worried about that information not moving with them to this new primary care provider, and they sort of have to start over. How do you work with them to make sure all of that's taken care of?
So some patients don't know a lot of the specifics of the medical stuff. So a lot of times I'll ask them, okay, do you remember the name of your doctor? Do you remember where you went? Do you remember what year it is? Do you remember if it was at a hospital? Because we can always request those records. And as long as I have like a general time frame or period, like say maybe they didn't know when they had their last colonoscopy, but they remember they had it with Lourdes. Well, then I should be able to see it in MyChart. But if they had it at Lafayette General, I can maybe check Care Everywhere. There's different options that I can do to try to request these records to see, okay, let me see who did it. Where was it? Are you due for another one? So it's kind of a detective work that we have to do on our end. So it is helpful if the patients at least kind of know what the specialist name was or where certain things were done at.
Yeah. And like you were saying earlier, too, with the medications and supplements, they might have several that they can't recall on the spot. So it's good to bring all that stuff with you.
And some of those names are crazy.
Yes.
For sure.
And I've had patients taking, different medicines, but they're in the same class. And they didn't know that they were, overdosing themselves on a medicine because they were two different names, but they were the same medicine, So I think it's important that they bring it in.
Yeah. Well, and I also wanted to maybe turn it around on you. So we were asking first about how the patient should prepare for that first interaction. What are some things that you do on your end for that first interaction? What's kind of like the mental checklist that you put together when meeting with them for the first time and want to make sure you cover everything?
The main thing that I look at for that first visit is, are all of my medications that you're telling me that you're taking, are they matching with the diagnoses? Are they, if you're taking this blood pressure medicine, I'm assuming that you have high blood pressure. So it's kind of like an investigative part on my side, just trying to figure out, why are we taking this medicine? Who put you on this medicine? Why were you on this medicine? Did you have a heart attack? Like certain medicines, they're on for certain reasons. So that's one of the parts that's most time consuming in the first, is just to try to understand what's happened. Where are we? What's already occurred in the past? Who are we seeing? So that's really the part that's the most time consuming for me, to go and read through all those records and understand what's going on, because I want to know everything.
Right. And obviously a lot of that work has to do with just listening to your patient, right? And so one of our big points is that we are the health system that listens. And our work is really grounded in listening to the patients and listening to each other and making that a big part of that interaction. So I guess you've kind of mentioned some of the investigative work, as you said. So maybe talk a little bit more about the strategies that you have and how you empower your patients to, I guess, take an active role in managing their healthcare through that experience.
I think MyChart is a big way that patients can get very active in their own healthcare, because they have access to their records. And I think it facilitates communication between not only their PCP and the patient, but also the specialist and the patient. And that's one huge advantage that patients will tell us, is that, hey, I didn't have a PCP. I was just at Lourdes Hospital and I was discharged, and, I'm seeing these specialists, and I think it's easier to see a PCP that's affiliated with Lourdes, because now all my records are in one spot and they feel overwhelmed. And this is one way to not be as overwhelmed, because we're all talking to each other, you know. I have the ability to talk to their neurologists. You know, I see their records from the hospital. I see that their cardiologist wanted this, and we're all able to communicate together through that. And I think that really helps the patients get involved in their care, because they have access to their care. And I think that's huge.
That is huge. Would you say that that's one of the kind of main differences of why it's so important to get established with a PCP versus going to an urgent care, is because of that network, and because kind of you're dialed in through every phase of their life with anything that could come up medically?
Yes, that's a huge advantage. I think a common misconception here in where we live is that you don't need to go to the doctor unless you're sick. And I completely disagree with that. I think that we go to the doctor to hopefully prevent from getting sick. Yes, our doctor can manage those acute and chronic illnesses, but what about those illnesses that we aren't aware of yet? And that's one of the things that, my dad, it was one of those people. He believed that he didn't need to go to the doctor because he wasn't sick. And so when he did get to the point where he was hurting, he didn't have a PCP to go see. So then he had to go to the ER. So now he's got an ER visit. Now he finds out he has hypertension. He has to wait to get established with someone, got established with something, and now his blood pressure is under control. And I said, if you would have had that PCP ahead of time and known, no one comes in saying, oh, my blood pressure's high and Liz is really high. Sometimes people think that they don't need to go see a doctor because they're not symptomatic. Our job is to prevent you from getting to that point where you become symptomatic. We want to take control of it before we get to that point.
Yes, definitely. I think even on the not even major kind of medical things that come up, but even when you have, like, let's say a sudden flu or a sudden random stomach bug or anything like that, I know those are typical things people would go to urgent care for, but is that something that you see in your practice that you can easily treat without, having to really dive into getting all the basics up front because you already know them? Is that typically what happens?
I'll get my patients, depending on what's going on, they can come in. If it's like an upper respiratory or a UTI, I can do a video visit, or I can do one in person, and they can just come by, drop off a urine, or come by, do the swab. We're trying to get our patients as much access as they can to us so that they're not having to go to providers who don't know who they are, and I can check on their record. Oh, she had COVID last month. Now she has the flu. Or we just treated her with this antibiotic. I might need to switch this antibiotic depending on what's going on. We have that record. We can see, what did we try last time? Did that work? Or last year she had this and this is what worked for her. We have that record that tells us a little bit more about the patient so we can give them the best care for them.
Yeah, I would say that's just really refreshing to hear, just someone who is a patient, right? Of not having to just reiterate and start from the top of, okay, well, this happened to me then. And you can you don't have to pick up from the beginning. You're kind of picking up from where you left off and you're already familiar with that. You don't have to retell your whole story because they already know.
Yeah. And you can save on time. You could save, maybe if you don't have access to transportation, you're not having to go to several different doctor's appointments across town. Obviously the cost benefit of seeing a PCP versus getting that care at the ER. There's a lot of variables there.
Definitely. Well, speaking of kind of patient experiences and patient stories, are there any that you've come across or that you've experienced that you'd be comfortable sharing about how them being treated in the primary care space has been life-changing to them or has made a huge difference in catching something ahead of time just in that preventative space that you've experienced in any of your patient encounters?
All right. So my dad started having severe shoulder pain. And mind you, he's not the kind of person who will ever complain about being sick or anything hurting. So he did not have a PCP because he was never sick. And he ended up having to go to the emergency room. And this is where we also find out that he had high blood pressure. And so on discharge, he was instructed to follow up with a PCP. And so that's whenever he found out about Lourdes Physician Group and MyChart. And so that allowed me to actually be able to access his care as well as a proxy. So I can get involved with his care as a family member, which I love as well too. And he could have avoided that cost of the emergency room and better managed his condition earlier and prevented further disease progression because of his high blood pressure if he would have been established with a PCP.
To switch gears a little bit, as we mentioned before, this is all about listening and how we listen to our patients. So we'd like to ask our guests this one question, which is in regards to listening. What have you been listening to lately? And it can be a podcast, it could be music that you're really interested into, something professional, something personal. We're always looking for good suggestions of content to check out. So sorry to put you on the spot, but
I like murder trials. So I've been listening to the Chad Daybell murder trial on so that, and I also listening to Reasonably Shady with Giselle Bryant and Robin from Real Housewives of Potomac.
We're familiar.
Yes, we love all the Bravo things. That's so cool, though. I think you'd be surprised. True crime has really, I think, made a resurgence with podcasting and how popular it is.
Yes, I find a lot of the investigative things that they have to do, we do a similar thing in the medical field. So it's kind of like we have to figure out these mysteries and they have to figure out these mysteries. So anyways, I find it's kind of similar.
Yeah, definitely. It's all piecing together the story, right? It's all part of it.
It's true.
Well, I guess before we go, is there anything else, Katie, that you wish you had shared or that you would want our listeners to know about healthcare and primary care?
Just because you aren't sick doesn't mean you don't need a primary care physician. Everyone needs a primary care physician, regardless if you're ever sick or not. You see a PCP to help you manage your health. And so to not only care for you when you are acutely or chronically ill, but to prevent illnesses and improve health. Just because you don't have any symptoms doesn't mean you aren't sick. With annual wellness screenings, PCPs can help identify and address disease processes earlier. And I think that's really the big message that I want to send about primary care.
Yeah, that's great advice. Thank you for being here with us, for sharing your story, sharing, just some advice on how people can get connected and why it's important to get established with the primary care. We appreciate your expertise and for spending time with us today.
No problem.
And listeners, thanks for tuning in. We'll have everything Katie mentioned and other helpful resources linked in the show notes. And we'll be back soon with more episodes of The Doctor Will Hear You Now, a podcast from Franciscan Missionaries of Our Lady Health System.
And if you have ideas for topics you'd like to hear on the show, email us at podcast@fmolhs.org. Thanks for listening.